we're going to take a look at the pediatric bag. Now, this bag is designed for pediatric specific equipment. So if you get that call for a pediatric patient, this is one of the bags that we would end up utilizing in place of our first in bag that you see sitting over there, right? So this is going to be more pediatric specific, and let's take a look at what we have in here. So right off the bat, we have a few things from an ALS standpoint. These are pediatric red dots, or the electrodes that are going to stick on to the patient. We also have available some of our suction kits. So these are French suction catheters. These are going to be, various sizes. So we open these up real quick and see that there are various sizes. And the reason there's various sizes is because, little kiddos are going to need to have something that's going to be a little bit smaller in diameter. And this is one example of that. Okay, so we'll just move that over here. Other things that we're going to find in our top pouch here is going to include our pulse ox probes. So we do have two different pulse ox probes that are designed to be in our bag. And these are going to hook up to our heart monitor, which also has the pulse ox in. And one is designed for neonates. Okay, so we can use that as a neonate. It could also be used as an adult, as you can see here, just by the way that this is designed. Shows you locations in which you can utilize it. And we also have one that is a pediatric. So they're all marked as to where they need to be. And one of the biggest issues that anybody would have to take a look at for these is going to be to make sure that these adapters truly fit inside of your heart monitor, or I'm sorry, in your pulse ox, which you can see sitting over there. And that's the one we really take a look at. Okay, so all adapters are not always the universal way. Okay, so we'll just get the rest of the stuff out of the top pouch here. And we saw with the first in bag, if you saw the first in bag video earlier, we had a blood pressure cuff. And we again have a blood pressure cuff designed specifically for the ped. And we also have a smaller Bell stethoscope so that, their chest is going to be a little smaller. So we want to make sure that we're going to be able to utilize that as well. Okay. So inside of our bag, and again, just to show you here, all we had to do was flip this up. So inside of our bag, we have various items particularly designed for the pediatric patient. And we'll just start right down here and we'll work our way through, okay? So again, back to, you have some gauze pads, some roller cling, additional tape, okay? So that's what's actually in this red bag. Probably not the best bag to put it in, but we also have some iodine swabs, additional 4x4s, some 3x3s, and little 2x2s that are in here as well. Then up here, I'm going to have various items, such as looking at an infant nasal cannula, and this one also looks like it is going to be another infant nasal cannula. This will be an infant face mask. Okay, so each one is going to essentially tell you what it is. So this is a infant oxygen mask. There's another infant oxygen mask, another infant oxygen mask, and we have one more. So this one here is a non-rebreather, and I really can't get in here without opening it up to show you that there is a difference in here. So we have the non-rebreathers and simple face masks as it relates to the infant. We are going to have in our center compartment, we're going to have, some people will hear me call this a snot sucker outer. This is not really what that is, but that's what it ends up being used for. This is a bulb suction, so we have the ability to clear out a child's mouth, a baby's mouth. We have our bag valve masks that are going to be in here, and we are carrying at least two different types. So we're carrying a neonatal, or I'm sorry, an infant bag valve mask, and there are additional masks that are also in here, as well as a pediatric. So when you get into kids, keep in mind that one of the biggest issues you're going to have to deal with is the fact that they all come in different sizes, and age does make a huge difference here, because it's going to help identify what type of equipment we may need to use on them. And so we're just going to move these off here to the side so we can finish taking a look at some stuff. Here we have, these are IO needles. So our IO needles are going to be readily available. Not only do we utilize a mechanical device such as the EasyIO, we also have available for quick access the manual IO needles so that we can actually twist these back and forth to be able to get them into the bone. Finally, one of the other things that we have is a length-based tape. So in Pennsylvania, one of the requirements for all ALS ambulances is the ability to have a length-based tape. The BLS version, or the BLS trucks, are not required to have a length-based tape, but they must have an electronic reference device. So the way that this would work is that you're going to weigh, or you're going to measure where that child is going to be. So you would start up here at the head, and wherever their heel ends up, so we'll just say that they end up into this purple area, they are going to be able, and we can see that there's a whole bunch of different medications that are there. The other great thing about this reference is it also gives us some overviews of the dosing that would be necessary for some equipment identification. And utilizing references really helps us out an awful lot because we're not always going to remember everything that is different with a child because we don't see them an awful lot. Here's just another pediatric reference, and this kind of talks about more of the vital signs, talks a little bit about some fluid replacement that's over on this side and additional equipment. So a couple different references, and again, these things are made available inside of that first in bag for the pediatric call. This side is going to be more oxygen supply, and we're just going to pull these out just so you can see what they are, or different versions, right? So these are going to be for the pediatric patient, as opposed to these here were for the infant. And additionally, not only do we have the masks, we also have the nasal cannula that's also going to be sitting here as well. And we also have this small volume nebulizer. So if we go to give any type of medication such as an albuterol inhaler, an albuterol treatment, and this is going to go into the small volume nebulizer. Oxygen hooks up to here, and we'll flow that at about 6 to 8 liters per minute, and you're able to allow the child to go ahead and inhale the albuterol. If they're unable to hold it, we can always hook this up to a nebulizer mask, and this allows us to be able to put this around on the face and nose, on the nose and mouth of the child, and they're able to breathe this in. So this would be, that mask is essentially designed for the child to be able to utilize. Now up here we have additional equipment. We're going to be talking here about various laryngoscopes. So laryngoscopes, here you see there is a curved, and one of the ones that's most common is going to be a straight. So for simplicity of the video, all we're going to tell you is that there is a difference between a straight blade and a curved blade as it relates to intubating the patient. And with children, it's usually a little easier utilizing the straight blade because they have big floppy epiglottises, and this actually will help control the epiglottis better than usually the curved one. But again, it comes down to a lot of times a matter of preference. Additional things up here would include a syringe. We also have a set of trauma shears. We have McGill forceps so that we can remove a foreign body airway, oropharyngeal airways. Again, a pen light. We have some lubricant for the endotracheal tubes, which we'll get to in a second. And again, more syringes and additional bulbs as needed. So there's also a small blanket that is in here. So if we had a baby who was delivered, we need to keep them warm, we could utilize one of those nice little disposable space blankets. Okay, let's take a look inside here. So inside of this compartment, we're going to have our stylets. Now, we'll probably end up redoing these at some point because usually when you have a stylet, We don't like to bend them like this because they have a tendency to get stuck in the endotracheal tube. So it's usually best to fold these right here, and that allows that it's not going to cause too much of a problem inside the endotracheal tube. Also in this compartment is going to be our various size endotracheal tubes. And here, this indicates the size, and this is going to be referred to as the internal diameter of that endotracheal tube. And these go all the way down to the nice little, small little babies. And here we can actually see that goes down to a 2.0. Okay. Additionally, inside here, we have once the endotracheal tube is put in and secured, it needs to be verified with waveform capnography. Electronic waveform capnography is a gold standard in how we verify tube placement. We also have the commercial tube device so that we can secure this to the child. And one last thing that's in here is going to be an extra set of batteries in the event that you know, where our laryngoscope batteries die for whatever reason. So always preparing for the worst situation that can occur. Okay, that should take care of everything inside here.